Good day everyone. Today guys, let's talk about the most wanted PRN medications here in the United States. Let's talk about narcotics. I want to discuss this because this will be an everyday thing for you nurses coming here to the US because it will be most likely part of your MAR, especially for those patients who are in pain and requesting for pain medications. Narcotics here in the US is not like back in the Philippines wherein they have to write specific prescriptions in order to get those for the patients. Here it's kind of like just like any other medicine that you can get from your Pixies or Omnicell. Though there's still some cautions that we have to do with this kind of narcotics, which I will discuss later on the video. For now, let's start with this. I don't know if you guys watched Dr. House, but the main character here was addicted to Vicodin, or he was addicted to Vicodin. At first, when I heard about Vicodin, I was thinking something really addictive kind of medications, though it is. But knowing now, working here in the United States, it's kind of like on the bottom part of the narcotics. So another brand name for narcotics would be Norco or Lortab. Okay, so these three are the most common type of generic names that we have usually encountered here. Generic name for this will be hydrocodone / acetaminophen. Normally, sometimes the doctors will give you a telephone order. They'll ask you to give Norco 5, Norco 10, or Vicodin 10, Vicodin 7.5. It's because it comes with different milligrams, like 5, 7.5, and 10 milligram. So that's what they meant. And the half of it, which is Tylenol, only remains 325 milligram. So now you know if they say like a Norco 5, Norco 7.5, you know what they meant. Normally, they give this every 4 hours to every 6 hours, depending on the patient's case and depending on the doctor who's ordering this. So I think for Dr. House in the film, I think he was taking this like 2 tablets. I think there were like 10 milligram of Vicodin, and he's taking 2 tablets and every 4 to 6 hours. So I think that's how addicted he was to Vicodin. The next one on the ladder will be Percocet. Percocet, generic name will be oxycodone / acetaminophen. So instead of hydrocodone, it's oxycodone for Percocet. So it's the same. It comes with 5, 7.5, and 10 milligram as needed. And they usually give this from 4 hours to every 6 hours as needed as well. Then, next one. If patients can take any oral form of narcotic medications, now we proceed with IV medications. And one of the most common one will be morphine IV. The usual dose we're giving here is from 0.5 milligram to 4 milligram. But normally, it's around 1 to 2 milligram that we normally give. And normally, we give it like every 4 hours for most of our patients. Except for those patients who are in comfort care, we normally give them like every hour to every 2 hours IV. So it really depends on your patient's case as well. But most of the time, it's Q4. A few things about morphine you have to take note. Number one, morphine can lower your blood pressure. It does. Not that much, but it can lower your blood pressure. So if your patient's having like 90/60 blood pressure, sometimes we're being more cautious in giving these kind of medicines. Sometimes we hold it off and tell them we'll recheck your blood pressure, then we'll give it a bit later. Then another side effect for morphine is it makes you sleepy. So if I have patients who are non-verbal or not able to communicate properly and they're acting like agitated, so sometimes I just give morphine instead of something else because morphine helps with the pain, and like I said, it makes you sleepy as well. Normally it works, but for some patients, not really. In some of the morphine IV that you will encounter, usually they'll come with jet injector syringes. So you don't have to get a syringe and needle to get those medications. So you just have to take out the green plastic and put it back and hook it to the patient's IV port. Then you can just push it. Normally for me, I don't really do this much. I prefer giving it with having some diluent with it. Normally I mix it with normal saline, maybe like 5 to 8 ml. But normally for me, I don't really give it this way. Sometimes it has some few more morphine left in the injector vial, so I prefer still using a syringe. Also, it's because I prefer to give it more diluted. Normally, I dilute it with like maybe 5 to 8 ml of normal saline. Because most of our flashes here for normal saline, they come with like a 10 ml. So I just waste like maybe 1 to 2 ml, then I give it. The reason I'm doing this is because I had a couple of patients before wherein I just push it directly, and sometimes I can see the vein like having redness all straight here, but it does disappear after a few minutes. Though they complain it itches a lot, so I prefer having it diluted. It works the same, and I think in some pharmacies or some hospitals they prefer you also to mix this with saline. Then for some patients, especially those with comfort care, and the doctors prefer to give them morphine orally, usually they order roxinol. It can be given either sublingual or oral, but most of the time it's sublingual. Normally in our hospital, they usually prepare this in 10 milligram per 0.5 ml. And the doctor normally orders only half, which is 2.5. So we only give the half. Then after that, we have to waste and discard this with someone else to co-sign you with a license. You have to do this on the Pixies or Omnicell 2 ways, okay? I will discuss it more later. Then another use for morphine here. We usually give this for patients with increased respiratory rate or shortness of air. That's usually the reason for PRN medications, and we give morphine. So if your patient's not in pain and he has that medication there and is recommended for patients with increased RR, then you can give that. Okay, so that will be part of your MAR as well. If your patients are not yet relieved with the pain with morphine, let's go to the next one, which is Dilaudid. Generic name for this will be hydromorphone. Okay, so normally we give this from 0.5 to 2 milligram IV push. So it is deemed like 7 times stronger than morphine. So this will be most likely the drug of choice of your addicted patients. So I'm sure definitely encounter addicted patients who are trying to seek pain medications or narcotics coming to the hospital. Normally when they come to the emergency room or to the hospital, they will always ask immediately for Dilaudid. Okay, so it's kind of a red flag sometimes that they already know what they want and they know how strong it is. For the 2 hospitals I work, Dilaudid is most likely the strongest pain medication we have. Especially in my first hospital, which is more a rural type, that's the most that they can give. The next step after Dilaudid for us here is sometimes we give a fentanyl patch, which we rarely do. If patients are like post-surgery, they normally resort to PCA pumps, which definitely we have to discuss in a different video. It's a long discussion. So for the next medications, they're not pain medicines, but I think it's worth discussing because this will be a common thing for you also. So next will be lorazepam. We normally give lorazepam through the IV here, especially for patients who are with comfort care. So we give it together with morphine every 1 to 2 hours. So the aim here is for patients to just rest and sleep before they go to their passing time. So we also give this medication for patients who are kind of slightly agitated. So we give this just to control their behavior. So this is a common thing we give here. It's usually through IV. It's every usually 2 to 4 hours, depending on the patient's case. Then another similar medication that we normally give here is Valium. It's usually given through IV. I think I remember I discussed to you before the medication error done by a Tennessee nurse here in the United States. Instead of giving Valium, she pulled out something else and it ended up killing the patient in the CT scan or the radiology department. So like always, be careful. Make sure to remember your 10 rights and make sure to get the proper medication that you're getting from the Omnicell or the Pixies. Okay. So for the diazepam or Valium, it's usually given for patients who are having like seizure episodes, or sometimes if we need to calm the patients down, especially if they're like claustrophobic or having some anxiety attacks. So sometimes the doctors will order Valium. So one thing to take note about lorazepam or Valium, I think the LPNs are not allowed to push these medications. So if you have LPNs during your rotations and they have these medications, definitely they will ask you to give this in behalf of them. If it's either you or someone like a charge nurse. So it is what it is. I'm sure they don't want you to have an extra work, but they really can't because that's the rules that they have, having an LPN license. Then another very common medication that we give here is called Geodon. Generic name for this is ziprasidone. I'm not really sure how to pronounce this, but we normally call this Geodon. It's the go-to medication that normally the doctor will order for patients having like agitations or really psychotic events. For example, in BMU or behavioral health units, this is the drug of choice we give for patients who are having like increased anxiety or increased hallucinations or those kind of things. So you might definitely encounter this. One thing to take note about this is we normally give this through IM or deep IM. So here, normally they want you to give it through the patient's buttocks. Yep, that's where they have to give. So you have to know about the technique on where to put those things, not to hit the specific nerve that they taught us before. Okay. Also, I will consider this one of the worst invention medication that to give for someone having hallucinations or agitations. Number one, because you have to mix this. Like there's a 10 ml vial with normal saline, I think. Then another powdered vial, and you only have to get I think 1.2 ml and mix it on the vial, and you will have to get usually a half dose of that, and it takes time for this to be diluted. So like I said, it's the worst medication to have during this kind of emergency because it really takes time. So I really wish we have something like more rapid that you don't have to mix and wait and you just can't have to jab the patients. I'm thinking like Lovenox that already has a syringe on it and just like poke a patient. That will be very ideal. And one more thing to take note here. It doesn't work immediately. Nope. It doesn't like work in the movies wherein you get the medication and inject them and they will like feel like sleepy and they'll just like drowse in the sleep. Nope. Never, never works that way. Even with lorazepam IV or diazepam IV, they don't normally fall asleep immediately. It takes time. So like for me, based on my experience, if I have to give these medications, normally I call like code green. Code green here in our hospital is something to do with like patients being violent and we need someone to help us hold down the patient. So normally we give it together when the security guards are there. Yep, they come up, they hold the patient, then we jab this to the patient. That's how we normally do it. Unless you have enough staffing that can hold the patient and the patient not really that big, and the nurses or the staff in the floor can be sufficient, then that will be okay as well. But for us, especially back in where I lived before in a rural place, we didn't have much staff and most of our staff were kind of small and most of them are ladies. So we usually call a code green for someone bigger. For the security guards to come and help us with that. So now let's go with the important tips or precautions about these narcotic medications or these medications that I discussed earlier. Like number one, if patients has a Suboxone on their medication list as like things that they normally take, it usually means that they have a history of drug use. Okay, Suboxone is given for like a substitute for narcotic medications for our patients. Usually comes with like a film type and usually they chew it like once or twice per day. So that's how they often have to get it. But based on experience, some of your patients will deny that they have any history of drug use. Yep, they will deny this. But when you see their medication list on the system, usually reflects like Suboxone. So you know that there's something wrong, that he or she forgot to tell you or he or she lied about it. It does happen, especially for those patients who are trying to get narcotics to their systems. Again, you have to take note of this. My charge nurse before said, I think they have contracts with getting these medications from their clinics. So they are not allowed to have any kind of narcotics in their system while getting Suboxone. Okay, so you have to take note of those. Because like I said before, some of the doctors sometimes would not review this properly and they will sometimes order narcotic medications, not knowing that Suboxone is part of their medication and having IV drug use is part of their history. So they have to take note or remind them about this. Okay. The next tip I can give to you guys is if you know patients are really asking for their narcotics, like really on the dot, then sometimes they even ask it earlier, like 15 minutes. Like we have a patient before, like she or she was asking like every 15 minutes before the time it was due. Definitely you have to set the boundaries. Tell them your medication is only due after this specific time. Okay. For these kind of patients, you do have to be firm and to be frank about these medicines. Okay, so these are narcotics. You have to abide the rules and tell them I can only give it on this specific time allotted. Okay, then in a lot of cases, especially for those night shift nurses, sometimes your doctor don't want to order any more narcotics for these patients. Yep, it definitely happens. There are a lot of times wherein the doctors know that the patient has a history of drug use and patient is already on Dilaudid every like 4 hours and he's getting like maybe 1 milligram and the patient still insists that he or she is in pain. And when you call the doctor said, I won't give him anything. Nope, that's it. So in this case, what will you do? So here I learned to be frank and told them that the doctor doesn't want to give anymore. That's it. That's a stronger medication that you have, and that's it. You have to wait for the morning doctors to see you and assess for your pain, and they might order you something else. So that's normally what I say to patients who are asking for pain medications. If they insist that they want to leave or want medications, just tell them the doctor said no. And if he insists that he wants to leave, then you can just say that he has the option for that. You always have the freedom to do that, and we have a HAMA form for that. So you just have to let them sign the form and make sure to take out the IV before he or she leaves. Okay? So that's one of the things that normally happens here in the United States. Then, another precaution I have to tell you guys, if patient has an IV drug use history and with unfortunate event, you have to put a line or PICC line for these patients. So make sure that you have to monitor them. Don't let them out of the hospital, or be wary of those coming in to his room, especially visitors, because sometimes those visitors are like bringing some medications that are narcotics or are prohibited for patients, and they have a quick access to their PIC line. Okay, so you have to take note about those as well. Take note of the patient's sedation, or how the patient's behavior is versus after the patient had a visitor. So it does happen. Okay. Then another tip I can give you guys, if the patient has a history of drug use, usually ask them if they have some medications with them, like inventory. You have to get those medications. If they have narcotics with them, you have to get those, confiscate them, and you have to put them somewhere else. Like in our hospital, we have a specific locker for these medications, and it will be documented and signed by the patient and counted for these medicines in order for it to be in a safer place, in order for him not to be overdosed. So you have to take note about this, okay? Because some patients, you will just realize that patients that become more druggy and more drowsy, and you really didn't give anything, and suddenly your patient became drowsy, unresponsive, and you found that in your purse that there are some pills on it. So it does happen, guys, okay? It does really happen here, especially for those who are really addicted to narcotic medications. They can be crafty, as super crafty. Okay. If ever a patient refuses to have her medications confiscated, then you have to document them and inform the doctor if you could. Okay. So at least you have those documented and you are protected, and you know that the patient doesn't want you to do anything about that. Okay, so these are few precautions that we had to do more for patients with narcotics or patients with history of addiction. Okay, then another thing, I think I mentioned this to you before. You can see some sores on their face. It's like a common, like a brown, grayish thing. It's not pimples, guys. It's usually called a met sores. Okay, so that's what you call it. It is really common for IV drug use, and you really can notice this. It's not only the face, you can see into the arms as well, or sometimes on the legs. So that's one of the red flags that you'll know that the patient has a history of drug use, if ever he or she denies that he's taking any prohibited drugs. Then another thing about drug users, like I told you before, they can be crafty as hell. Okay, I remember before some of my colleagues said that some of their patients are coming in complaining that they have spider bites. And you know where their spider bites are? It's usually on the perianal area. It's usually for the guys, it's like the balls and the butthole, and it's in between that. That's where they inject the medications. And that's where they claim that's where the spider bite is. Yep. That's how they do it, because especially for those patients who are out of parole, and they have to be crafty because they will be done inspection every few days to check if there are any signs of having drug use. So usually they put it places where are not really normally they will find. So you can find that on that part. So it's usually not a spider bite on that places. Okay, so take note of that. Other places they inject is sometimes on the foot, in between the toes, in the middle. So sometimes they inject those medication in those areas. Okay. Then I work in behavioral unit before. Before they admit the patients, they have to be stripped down, and they have to sit down and cough. They're squatting, and they have to cough, because sometimes some of the patients, especially those who are really addicted, they can shove things in their butthole to keep medications in order for them to have their supplies. So in BMU, they usually do that in order to screen these patients. But in the medical surgical floor, we don't normally do that. Okay, we rarely do that. So, and it's also not right to accuse patients of having drug medications or drug use if we don't have any evidence. So normally we treat them with respect. Whatever the case, you have to treat them equally and talk to them equally. Then other basic precautions, of course, allergy. You have to take note if the patient has an allergy for these medications. Normally, if you have a pharmacist, normally they'll be the one to screen that for you. But if you don't, make sure to browse and check if they are allergic to this medicine. Okay, so observe for any signs of allergic reactions during the first time you give this medicine. Then another thing to take note, most of the narcotics, especially the IV ones, take note of their blood pressure, because most of these medications will lower down some of their blood pressure. Not much, but they will, especially for patients whose blood pressure are on the lower side. So you have to be cautious on these patients. Okay. So for those watching, please comment down on what are your common narcotic medications that you normally give to your patients in your facility. I would just like to learn and to know what's the preferred medication in your specific area. Or anything funny related to that kind of situations, because most of the time it is funny and something really memorable. I have a lot of those and I just can't share them because of some violations, so I don't want to discuss them and have those mistakes. So I think that's it for the narcotic medications and other PRN medications. So if you learned something, please help me support my channel by clicking the like, subscribe, and share button. Okay. Then also, if you can ask a favor, if you can support me in my TikTok channel as well. I need at least 10,000 followers in order to be monetized. So hopefully you can guys help me subscribe to my TikTok channel as well. I have like 30 days in order for me to do that. So please, if you could, please help me follow there. Okay. So again, my name is Nurse Juan de la Cruz, your OFW nurse. Thank you for watching. God bless. Bye-bye. Stay safe.